Cats appear to be masters at masking their feelings with an air of independence. This can make it challenging to know when your furry friend is under the weather. Understanding the signs that indicate your cat may be sick is crucial for any cat owner. Today we're diving into how you might be able to tell if something is off with your whiskered companion. Changes in behavior. Cats thrive on routine and consistency, making it relatively straightforward to spot when something is amiss. Any marked shift in their typical behavior, be it a sudden preference for solitude or a drop in playful antics, can be a significant indicator of health issues. For instance, a cat that typically greets you but has started to hide more could be experiencing pain or discomfort. Increased hiding is not just a quirk, it's a survival mechanism that can signify illness, making it crucial for owners to take note and react accordingly. Similarly, changes in how a cat interacts with its environment, or the people in it, can be equally telling. A cat that suddenly becomes aggressive or irritable could be dealing with discomfort or stress. This behavior shift might manifest as unprovoked hissing, swatting, or biting, which are not typical for well-socialized felines. Such changes are particularly concerning if they deviate sharply from their normal demeanor. It's essential for pet owners to observe these behavioral changes carefully, as they can provide the first clues that their pet is not feeling well and may require veterinary attention. Altered eating and drinking habits. Changes in eating and drinking habits are critical indicators of your cat's health. A decrease in appetite could hint at issues such as dental pain or gastrointestinal disorders, while an increase might suggest diabetes or thyroid problems. Additionally, changes in water consumption are significant. Increased drinking can be a sign of kidney disease or diabetes. Monitoring these habits is essential because cats typically disguise their discomfort, and these could be some of the first visible signs that something is amiss. Observing your cat's behavior around their food and water bowls can give you essential clues about their health. If your cat suddenly shows disinterest in their food, first consider whether the food is fresh and appealing, or if their feeding area is clean and quiet. Both overeating and undereating, along with significant changes in drinking habits, warrant a professional evaluation to rule out potential health issues and ensure your cat remains in good health. Changes in grooming habits. Cats are known for their meticulous grooming habits, spending a large portion of their day cleaning themselves to maintain their coat and overall health. However, if you notice your cat suddenly neglecting their grooming duties, it could be a sign of illness, discomfort, or old age, as pain or lethargy may prevent them from properly caring for their fur. Neglected grooming can lead to matted fur, skin issues, or an overall dull appearance, signaling that your cat is not feeling their best. Conversely, excessive grooming or overgrooming, where your cat may lick or chew their fur to the point of causing bald spots or skin lesions, often reflects underlying issues like stress, allergies, or dermatological problems. This compulsive behavior requires attention, as it can lead to more severe skin infections or conditions if left unchecked. It's important to monitor your cat's grooming behavior closely, as changes can provide critical clues to their well-being. A decrease in grooming might suggest mobility issues or a decrease in physical health, while excessive grooming could be your cat's way of coping with discomfort or anxiety. Addressing changes in grooming habits early can prevent complications, reduce discomfort, and ensure that underlying health issues are managed promptly. If you notice any of these changes, a visit to the veterinarian is warranted to determine the cause and receive appropriate treatment. Monitoring and maintaining your cat's grooming routine is an essential part of keeping them healthy and happy. Unusual litter box habits. Monitoring your cat's litter box habits is crucial for detecting health issues early. A change in frequency, whether it's visiting the box more or less often, can indicate various conditions from urinary tract infections to kidney disease. In addition to frequency, pay attention to changes in the color, consistency, or smell of urine and feces. Dark or bloody urine or unusually soft, hard, or foul-smelling stool can be signs of underlying health problems requiring veterinary attention. Such observations are essential for maintaining your cat's health, as these signs can escalate quickly if not addressed. In cats, subtle changes in behavior can be significant indicators of health issues. If your cat suddenly starts avoiding the litter box, it might be experiencing pain during urination or defecation. This avoidance can lead to inappropriate elimination, which can cause further stress for you and your pet. It's also vital to observe whether your cat is straining or crying out in pain while using the box, as these are direct signs of discomfort that warrant immediate veterinary care. Regular monitoring of your cat's litter box usage and being alert to these changes can ensure you catch potential health problems before they become more serious. Physical symptoms. Visible weight changes, either loss or gain, can be alarming signals of health problems in cats. If your cat suddenly becomes thinner or heavier without any changes in diet or activity levels, it could suggest metabolic issues, thyroid problems, or other underlying conditions. Similarly, bad breath might indicate dental disease, while changes in the appearance of their eyes, such as cloudiness or redness, could suggest infections or systemic health issues. A runny nose, persistent cough, or labored breathing are signs that your cat may be suffering from respiratory conditions or even cardiac issues. Any of these symptoms warrants immediate veterinary attention to determine the cause and commence appropriate treatment. The presence of unexplained lumps, bumps, or wounds on your cat's body should never be overlooked. Such abnormalities could be benign, but they could also indicate infections, abscesses, or even cancerous growths. Early detection and diagnosis by a veterinarian can be crucial for effective treatment. Additionally, any sudden changes in your cat's grooming habits, such as neglecting to clean themselves or overgrooming specific areas, can be signs of distress or pain related to these issues. Prompt veterinary examination and treatment can prevent complications and help maintain your cat's health and quality of life. Lethargy. Cats are indeed notorious for their lengthy napping habits, often sleeping up to 16 hours a day as part of their normal routine. However, an increase in this already substantial sleeping pattern or a noticeable decrease in their usual activity could be indicative of health issues. When a cat appears unusually lethargic, shows little interest in play or interaction, and withdraws from their routine activities, these can be signs of underlying illnesses such as infection, diabetes, or even organ dysfunction. Observing these changes in behavior is crucial for early detection of potential health problems. Additionally, if your cat's lethargy is accompanied by other symptoms like loss of appetite, vomiting, or an unusual posture, these could further suggest that something is amiss. It's essential to monitor not just the amount of sleep your cat is getting, but also their overall energy levels during their awake periods. Cats that remain passive most of the time or show reluctance to jump or climb as they normally would may be experiencing pain or discomfort. Consulting with a veterinarian can help determine the cause of this change in behavior and ensure that your cat receives the necessary care and treatment to return to their normal lively selves. Recognizing these signs early can be the key to preventing more serious health issues for your cat. If you notice any of these symptoms, it's best to consult with your veterinarian right away. After all, our cats rely on us to be their advocates and ensure they get the care they need. Remember, you know your cat best, so trust your instincts. If something seems off, it probably is. Until next time.